My name is Shirley Ingram. I'm an advanced nurse practitioner in cardiology nursing. I've worked here since the doors opened. I trained in the Adelaide, qualified back in 1989, and apart from a little interlude in Australia, I've always worked in Tala Hospital. When I qualified back in 1989, I immediately went into coronary care nursing. So I've nearly 30 years experience now working with cardiac patients. From there I moved into the area of cardiac rehabilitation. So after the acute care of heart patients, I then went into looking after people after they've had a heart attack and helping rehabilitate them. And that's when I became a clinical nurse specialist in cardiology. At this time also I did my master's through research as well, through Trinity College. I was there for a good 10 years or so. I really enjoyed that. Then I got a chance to work as a CNM3 in cardiology. This was more of a management post, but it was still very clinically focused. And this gave me great insight into all the other areas of cardiology. And I felt I had a lot of influence there over clinical issues. But I really missed the patient contact. So after a few years of doing that, as part of my job doing that, I put together a business case which was looking at the treatment of patients who present to Tala Hospital with chest pain. And I was offered the opportunity then, through my director of nursing, to commence on the pathway to be an advanced nurse practitioner. It means I am fully autonomous and I'm responsible for my own clinical decision making. So I can see patients directly. I see patients in the emergency department who present with chest pain. I assess them, I take a history, I examine them, I plan interventions and treatments, and which will ultimately lead to a diagnosis for these patients. I do it in the emergency department here, and then I also run my own nurse-led chest pain clinics every day in the outpatients. And I also run a post-stenting clinic for patients who've been treated for their coronary disease. So I see it as treating the patient full circle from when they come into the emergency department to when they've had their treatment. The beauty about working as an AMP is you are autonomous. I don't need to resort to a medical practitioner for my decision making. So this has great benefits for the patient because it's safe care, it's competent care, and also it's very time focused. You're not waiting around to see a doctor when you're down in the emergency department. So I can make my decisions myself. I am responsible for those decisions. But the beauty about Tala Hospital is you're never on your own. I work with a great team, and that includes the physicians and the doctors in cardiology and in the emergency department and the acute medical unit, the nurses in those departments, the technicians in cardiology, and all of the admin staff. So while I am autonomous, I know I'm not working on my own. I love the patients that come into Tala Hospital and also the staff here. I mean, I have been within Tala since the base hospitals in the Adelaide. I still know a lot of people here from the base hospitals, and I feel that they're more like your family, like your friends. In cardiology, we have a great supportive network amongst the CNMs. So nursing is very strong here. We look after each other, we support each other, we encourage each other. They're a great bunch of nurses in cardiology. A lot of expert nurses, so we support each other as we're going along our career paths. And that's what I really like about working here. I think if you're motivated, if you care about patients, if you see a way to improve patient care and their patient pathways, if you're driven, if you want to become an AMP, you will be supported in Tala Hospital. It's a long enough journey. I had great support from my cardiology nurses, from my peers, from my consultants, from management also. And I don't think the journey is over for me either. I believe that there's much more scope here for cardiology nursing. So if anyone out there is interested in starting from scratch, becoming a cardiology nurse, come to work in the coronary care unit. You get loads of experience. Your years of experience will grow, and then you can become a clinical nurse specialist, leads on the pathway to AMP. I think in the Irish healthcare setting at the moment, AMPs are going to become more common, and I think Tala is very proactive about supporting AMPs.